People who walk at least 7,000 steps each day are about 30% less likely to die from any cause, because walking improves many systems at once. It improves blood flow, lowers inflammation, stabilizes blood sugar, supports heart health, and strengthens brain health. It is the safest entry point for movement because the impact on joints is extremely low. Runners experience injuries almost 40% of the time each year, while walkers experience less than 1%. Even 10 minutes of walking drops stress hormones by around 15%, because walking activates the parasympathetic nervous system, the system that calms the body. When you walk after a meal, your blood glucose level drops by nearly 30%, even if you have insulin resistance, because the muscles immediately pull sugar from the bloodstream. Walking also protects cartilage, because each step pushes nutrients into the joint surface and keeps it hydrated. That is why regular walking reduces arthritis pain by about 25%, even in older people. People who walk fall asleep 30% faster and spend more time in deep sleep, the phase when the body repairs itself. The best practice is 10 to 15 minutes after meals, morning light for lowering cortisol, and evening walking for breathing and stress relief. The ideal total is 60 to 90 minutes a day, with 70% at a moderate to brisk pace around 4 to 6 km per hour, because slow walking gives only about 40% of the metabolic benefit. But if you walk too fast and you have sensitive airways, cold air may irritate your bronchi, so moderate pace is best. The next exercise that surpasses walking is cycling, especially at a steady moderate or vigorous intensity. Only 30 minutes per day can give 50% greater improvement than brisk walking. It loads the heart and lungs without loading the joints, because the knees, hips, and ankles take almost no impact. Cycling strengthens the quadriceps, the gluteal muscles, and the calf muscles, which dramatically improves insulin sensitivity and resting calorie burn. It almost doubles the improvement in oxygen capacity, also called maximal oxygen use. This capacity is one of the strongest predictors of lifespan. Just 20 to 30 minutes of cycling pushes the heart rate into the ideal cardiorespiratory zone, where the lungs open wider and the tiny airways expand. People with mild airway reactivity often tolerate cycling better than fast walking because the airflow is smoother. Cycling improves glucose control by 30 to 40%, especially in people with early metabolic problems, because large leg muscles burn sugar even at rest. Both indoor bikes and normal bikes provide nearly identical benefits. The third exercise is stair climbing, which triggers the strongest cardiovascular response for every minute spent. Even 10 to 15 minutes can improve cardiorespiratory fitness 2 to 3 times more than brisk walking and about 60% more than moderate cycling. Climbing only a few floors a day lowers heart disease risk by 15%, and climbing 5 to 7 floors lowers it by more than 30%. It trains the lungs as a natural breathing exercise, because every climb forces deeper breaths and keeps the small airways open. Consistent stair climbing improves lung capacity by 10 to 15%. It is one of the highest intensity low-impact movements. It burns 2.5 to 3 times more energy than brisk walking. 10 minutes of stair climbing gives the same heart and lung stimulus as almost 30 minutes of brisk walking. 3 sessions a week are enough, starting with slow, controlled pace and gradually building to around 10 floors. The fourth exercise that surpasses even stair climbing is swimming, especially freestyle or lap swimming. Swimming trains the entire body in a weightless environment, so the joints carry almost no load, yet the heart works harder than during land activities. Swimming improves cardiovascular fitness 2 to 3 times more than brisk walking and 30 to 50% more than moderate cycling. Regular swimmers have 40 to 50% lower mortality, one of the strongest protective effects seen in any aerobic activity. Water creates 8 to 10 times more resistance than air, so every movement becomes a natural strength exercise. This resistance increases muscle tone, metabolism, and fat burning while keeping the heart rate in the ideal zone for oxygen capacity improvement. For the strongest benefits, swim 30 minutes 3 to 4 times per week with warm-up laps and moderate or vigorous laps. Pool water around 26 to 28 degrees keeps joints and bronchi comfortable. But there is an exercise that goes even beyond walking, cycling, stair climbing, and swimming. That exercise is squats. Just 10 minutes of squats equals about 70 minutes of brisk walking because muscle activation is around 10 times higher. Squats improve insulin sensitivity almost 3 times stronger than walking, because the largest muscles of the body are activated at once. The quadriceps, the gluteal muscles, and the hamstrings work together, and this raises metabolic rate for hours after the workout. In 8 to 12 weeks, lower body strength increases by 30 to 50%. 3 sessions each week are enough. 3 sets of 10 repetitions build a strong response. Small weight increases every 3 weeks provides safe progression. Another exercise that gives upper body benefits far beyond walking is the push-up. Just 5 to 7 minutes of push-ups provide the same upper body muscle activation as 40 to 50 minutes of brisk walking. The chest, the shoulders, the triceps, and the core become activated 8 to 12 times more than during walking or cycling. Push-ups improve insulin sensitivity almost twice as much as walking because upper body muscles respond quickly to resistance. They increase upper body strength by 20 to 40% in 8 to 12 weeks. 3 sessions a week with 3 sets of 6 to 12 repetitions create full benefit, and knee push-ups are a safe starting point for beginners. And finally, one of the safest and most powerful exercises without equipment is the plank. 2 minutes of planks activate the deep abdominal muscles 15 to 20 times stronger than walking and 4 to 5 times stronger than cycling or swimming. The plank trains the transverse abdominal muscle, the oblique muscles, the diaphragm, and the deep stabilizers of the spine. This is why it improves insulin sensitivity 2 to 3 times more than slow walking. Planks reduce lower back pain by 30 to 40% in 6 to 8 weeks because they stabilize the spine better than most other exercises. They strengthen breathing mechanics and help the rib cage stay more stable. 1 minute of plank equals around 15 to 20 minutes of brisk walking in metabolic effect. 3 sessions a week with short holds and gradual increases give one of the strongest effects on posture, metabolism, and core strength. These 6 exercises create a simple message. Walking heals, cycling strengthens, stair climbing transforms, swimming protects, squats rebuild, push-ups shape, and planks stabilize. Together they offer one of the strongest combinations for health and longevity.